Welcome to Share, a podcast production of Amethyst Recovery Centers. I'm your host, Kabir Singh. At the top of each episode, we like to remind our listeners that addiction is treatable and recovery is possible. If you or a loved one needs help with addiction, call Amethyst today at 855-80-SOBER or visit us online at amethystrecoverycenters.com. Today, we're going to dive into the restaurant industry and specifically what's been going on in it during the COVID-19 pandemic. Our guest today is Dr. Diego Bufquin. He's an associate professor at the University of Central Florida's Rosen College of Hospitality Management in Orlando. Recently, Dr. Bufquin co-authored a study that examined the relationship between service industry employees' work status, mental health, and substance abuse during the pandemic. The study found that working employees experienced higher levels of psychological distress, drug and alcohol use than furloughed employees. We'd like to dig into that with Dr. Bufquin. Dr. Bufquin, welcome to Share. Glad to have you.
Thank you, Kabir. Thank you very much for having me. It's a pleasure.
So we thank, of course, and so we opened up just for the listener because I'm butchering your name. It was so eloquent how you pronounced. Can you just do that for us real quick? Your name the way it should be said.
Yeah, so I'm half French, half Brazilian, so my last name is French, and it's pronounced Bufquin.
Okay,
but
there's no way. I mean, there's just I would have had to take this entire pandemic to practice that in order to maybe get that right. So thank you for that. But I will continue with Dr. Bufquin. So, welcome. You're down there in Orlando. The study that I opened up with and I talked about, the restaurant industry has millions of employees, really, in the United States. It perhaps the most vulnerable to drug and alcohol use, even outside of the pandemic. So why do you think that is, that industry is that way?
Well, it's an industry that is characterized by a fast-paced work environment, a stressful work environment, in which employees have to work usually very long hours, sometimes multiple shifts during a day. They have to work also night shifts, and also on weekends and holidays. And so on top of this, lots of food service jobs are not really well paid, right? You could have some tip positions that eventually get some more money than other positions, but for example, a cook would usually get an hourly pay. It depends. It varies according to the restaurant, to the state. And so, but a cook could eventually get paid like $13 to up to $18 an hour, and that's pretty much it, and that cook would probably have to work extremely hard, again, in a fast-paced work environment, stressful work environment, and get little recognition at times for such work efforts. And so, because of all these factors, there's a tendency for food service employees to have more, let's say, issues regarding substance abuse, including drug and alcohol usage.
Without being an expert, essentially what I consider you to be, so when I come here to work, maybe it's a little unfair for me. I work in substance abuse treatment centers, but most people, they go into work, right? There's not a full bar. So the propensity to, hey, I'll have a shot, cut the edge, combined with the fact that, if I'm working on, spreadsheets all day, I don't necessarily have to have a smile on my face, right? The hospitality industry, and again, you being the expert on this, I mean, you have to sort of leave all that stuff back at the door when you come in, and present our best selves to the patron. And it,
Yeah. No, you're absolutely right. I mean, like the fact that restaurant employees, food service employees, um, some like a pretty significant portion of them have direct access to alcoholic beverages and so forth. Um, Plus the lifestyle, that goes on with working in the food service industry or restaurants or bars and nightclubs and so forth. That definitely can induce lots of employees to consume more, right? And so that for sure. I mean, having access to beverages, all kinds of beverages, all day long and so forth. And plus sometimes, some restaurants or bars or nightclubs, they have a culture, a pretty interesting culture regarding uh, alcohol use, right? Most of the time. So, some restaurants, for example, will allow their employees to, open a couple of bottles of beer at the end of the night shift, for example.
right.
That would be something that is considered as tolerable by some, bars or restaurants, uh, bar or restaurant owners or operators, right? So, yeah, so the fact that employees have access to beverages and and the fact that some restaurant companies or food service companies actually allow their employees to drink after they're done working, that all these things can have an impact as well on the substance use of from food service employees.
Yeah, that's certainly a set of circumstances which is highly unique to the industry. As I sit here and sort of digest everything that you're mentioning to me, having spent time, uh, maybe not so much as the staff, but friends of staff. The place closes down, and the owner is okay with beverages being served outside of hours. And I remember for me, a person in recovery, it wasn't uncommon for all of a sudden it's like 5 a.m. and it led to its own issues with me. And so I could see how that just the snowball effect there can really perpetuate anyone that has an issue and perhaps less control over the matter.
And also, let's talk about also the social-demographic characteristics of restaurant employees or food service employees. Usually, food service employees tend to be younger, um, less educated. Uh, so there are some socio-demographic characteristics that also have an impact, could have an impact on um, the fact that some food service employees eventually have some substance use um, issues, right? Because
Right.
when you're younger, you take more risks, et cetera, et cetera. And the food service sector is known to employ a younger workforce, which tends to work part-time, and et cetera. So, yeah, I think some of those socio-demographic characteristics could also have an impact on the substance use of food service employees.
That's certainly makes sense there. So you're down there in Central Florida's Rosen College of Hospitality Management.
Mhm.
Orlando, of course. I think I feel like there was a hotel down there on International Drive called the Rosen. Did they have a
Yes,
hotel?
yes.
Yeah.
Our school is named after Harris Rosen, who is an entrepreneur here, who graduated from Cornell, the hotel school in Cornell, and basically he used to work for Disney, got fired from Disney, and he said, you know what, I'm gonna open my own hotel company. Started opening one small little limited service hotel here near the convention center in Orlando. Then was successful, opened a second one, third one. Now I think he has over 8 different properties, and some of these properties are very, very large. Like the Rosen Shingle Creek has over a little over 2,000 rooms. So basically, our school was named after this entrepreneur, who is one of the most successful hoteliers here in Orlando.
I recall being at a convention and kind of walking down International Drive and noticing that one Rosen property there. So thank you for tying that all together. That's an interesting story. So the study, I'm going to focus on the study here. What do you think caused psychological distress and substance abuse, sort of, within your study? That
Yeah, of course. So, we thought that furloughed employees would eventually suffer more mental health issues and substance use issues, and also would have higher turnover intentions than working employees during the pandemic, working restaurant employees during the pandemic, because we thought, hey, you know what? If you have a job, if you still have a job during the pandemic and you're still working and you were not furloughed, maybe that could be, let's say, a motivating factor for you to, have a healthier mental state, or, by working, you would also use less drugs or alcohol and so forth, and have lower career turnover intentions. But what we found out was the opposite. Actually, we found out that working employees experienced higher levels of psychological distress, drug and alcohol use than furloughed employees. And also we found out that psychological distress increased drug and alcohol use, okay, which makes sense, right?
Yeah.
If you're more distressed psychologically, you'll probably start using more substances, right? And you will, and also we also found out that psychological distress increased career turnover intentions, which makes sense. So, but the most interesting finding, I think, from the study is that all employees, regardless of their mental health, increased substance use during the pandemic.
So all employees means furloughed or otherwise working, but that entire set.
All the entire set of working and furloughed employees increased their substance use during the pandemic.
So was there one particular or a set of factors that was the same between those two groups?
Yeah. So, as mentioned earlier, working employees were clearly having a higher psychological distress and were using more drugs and alcohol than furloughed employees. And we believe that because we surveyed these employees, it was last May, so May, June, when the pandemic was at its beginning, and so there were a lot of unknowns about the pandemic at this time, and a lot of stress. I don't know if you guys recall, but last year, when the pandemic was ravaging all over the world, starting to ravage all countries around the world, there were so many unknowns, and plus the fact that for the first time in our lives, probably we were all asked to stay at home, right? There were there were lockdowns all over the place here in America as well. Several states had decided to lock down. And Florida was not different, like here in Orlando, we would also, the governor back then also asked all businesses basically to remain closed at the beginning of the pandemic. And so I think, working employees were suffering more from psychological distress and were using more drug and alcohol because for a variety of reasons, I believe. Number one, because of the pandemic and the uncertainties related to the pandemic, so they were basically working in a work environment that was extremely stressful back then. They were dealing with customers. They were probably unsure as to how healthy working in such conditions was for them, right? Because they were probably, most of them, wearing masks, but I'm pretty sure that lots of employees were afraid of catching the virus while working.
Yeah.
right? So that had an impact probably on their mental health and substance use. Also, working employees, I think that many of them back then were unsure whether they would keep on working for a long time or if they were going to lose their job in the next few weeks or months, because back then, like, so many restaurants were closing one after another. And so I think lots of working employees were, although they were working, I'm pretty sure they had this fear um, of not knowing until when they were going to be able to work.
Right. They're sort of living under that unknown, that uncertainty, which does not prove well for any sort of psychological situation. And then in contrast, and you're probably likely getting to this, you have the staff or the worker, restaurant industry worker, hospitality industry worker that is laid off at home, maybe on unemployment, so having some basic needs met, but totally isolated and able to buy alcohol, whatever, isolated,
Absolutely.
gets out of control.
And also, I think working employees were also more stressed and were using a little more substances than furloughed employees, because also, there was a significant reduction of customers, right, during those months of May, June. So basically, restaurants were open. Some of them had to close, obviously, but those that remained open, they were, serving very little customers. And so those employees that were still working and serving those few customers, I think that must have had an impact as well on their mental health as well, because they were there for long hours, maybe 8 hours a day or something like that, and seeing very few customers, serving very few customers. So therefore, so the servers who were getting tips, they were suddenly their tips just dropped tremendously, right? So they were getting a lot less money to stay there and work there at the restaurant for 8 hours or something like that. And so all of these things, all of these financial, health uncertainties and so forth, all of these factors probably had an impact on working employees.
There was a strong pivot into carry-out services as well. And so while some still remain working and still in the hustle and bustle of producing finished products, good finished products that need to be created and carried out, the pressures there to still produce, for the kitchen staff. And then there's also less social interaction with your coworkers. Perhaps one of the things I've noticed is people take carry out. Well, nobody, laid out the white linen tablecloth, right? And there was nobody refreshed my water. So therefore I don't need to tip. And so there's a reduced income coming from there, yet perhaps some pronounced work levels. It's interesting as I talk to you about this and really sort of put myself into the staff's shoes. I was at an establishment last night with a couple guys on my network, and this is a restaurant group owned, by a large restaurant group, corporation, if you will. And so I think they're sustained through that. But I just sat there, and I remember talking to my two guys, like, this is really, really sad. And our server, Adam, he was a delight. I mean, he so grateful that we were there. Thank you for coming in. Thank you for choosing us. And we live right here where I'm talking from right now in Montgomery County, Maryland. Is still very restricted. It's like a 25% capacity. So many different tentacles to this thing that are feeding into it, and I'm really grateful for your study and that you did what you did here.
It was very interesting to find out, all these things, and everybody suffered. At the end of the day, that's what the paper basically reveals. Everybody suffered during the pandemic, whether you were working, whether you were furloughed, and the pandemic just took a toll on all of us.
Still is.
It still is taking a toll on all of us.
Yeah. I hate to think what the finite study on the restaurant owner looks like. What the poor people that actually maybe coming out of pocket to keep these places propped up. It's a whole nother sort of set of talks there. When you think about the restaurant industry as it stands right now, do you think that if industry was to come together and bring you on as a panel, what would you do to combat some of these findings that you have discovered or offer them?
Well, in periods of tremendous uncertainties and, regarding, you know, your economic situation or even your health, because that's what the pandemic had two major impacts on people's lives. People were worried about their health and their economic situation, right?
Right.
And so the pandemic basically produced damage on both ends of the spectrum. And so back last year when we collected data, because this was a new virus, even the scientists were not really sure of what the virus could do, how we should behave, and all of the guidelines that we have nowadays that are very, very clear, but back then they were not so clear, right? I remember the CDC, for example, saying no, you don't need to wear masks, way back then, when the pandemic started. No need to wear masks, and then suddenly they changed, and no, you actually need to wear masks, absolutely. And so there were so many uncertainties regarding this new virus that, if something like that happens again in the future, probably people are going to be as afraid. They're gonna react kind of like in similar ways as to how they reacted, for during the COVID-19 pandemic. So whenever something new, a new disease, a new virus happens or occurs, that new disease, of course, brings a lot of uncertainties into people's minds. And what do people usually tend to do when they're concerned about something that they are not familiar with, and that is ravaging the entire planet? All communities, across America and throughout the world. Well, they tend to start, and when they're also told to stay at home and keep social distancing and so forth, we are social animals, right? And so when suddenly you're told, no, you have to be isolated, don't go out, etc. And we all know that some folks, for example, in New York City, they live alone in small little places, small apartments, etc. So so when you're told to stay at home, isolated, and you're unsure whether you're going to be able to keep your job, keep your salary or benefits and so forth, people tend to start to struggle, psychologically speaking, and many folks start to use substances. So my advice would be to really try to find alternatives, to healthy alternatives, to be able to reduce the stress that you're going through basically. And so that would include what some you could eventually practice some sports, for example, or you could eventually meditate, or you could eventually read books, study. There are some, or keep in touch with your family members as well, so your friends via social media, or just call your friends and family, stay in touch with them on a regular basis, just by sending them text messages or having chats with them on
It's interesting that everything you're just now mentioning are sort of very congruent. Again, the listeners know that I'm a person in recovery. Much of what you mentioned are very congruent with sort of this mindfulness, right? So if I'm lacking this now, rather than too much sedentary time, too much idle screen time, right? The screen time outside of Zoom connections, FaceTime and things like, just as I'm looking at a screen and some sort of unproductive thing. it makes sense, right? It become more connected. It is, weather and things obviously have a lot to play into that. With colder months, so we have to find some sort of activities to do. So, and other than the obvious, so linked up with Amethyst Recovery Centers, that being a resource to anyone who's listening to this, who's in the service industry, that is looking for help. Is there anything that just pertain? Is there? I guess what I'm asking, is there like a employee assistant organization for the restaurant industry, like a national? Is there something that folks can reach out to in that particular subset, or do you?
So restaurants, they could eventually, and that's what some of the best hospitality companies have done. They have kept communicating. They kept on communicating with their employees, whether those employees were furloughed or still working, on a regular basis. So I think communication between the employer and the employee during those crises is extremely important, because employees, if they, if they cannot communicate and get some clarification regarding all of their questions that they might have with their employer, then that's not great for their mental health. So I think employers, what they can do is to eventually focus on providing some great communication with their employees, whether these employees are furloughed or still working. Also provide some useful resources for employees to eventually reduce their mental health struggles. So, for example, resources such as hotlines, right, which already exist, which are already available for everyone to use, or also restaurant companies or food service companies, they could. It's important that most of their employees get some kind of health coverage, because without any health coverage, it's just impossible for employees to eventually have access to therapists, right? Yeah. So, having access to therapists or psychiatrists during those hard times is a must, right? And I think the availability of psychiatrists or therapists is essential for some people to heal, or at least try to better understand their conditions, and to heal as fast as possible, right? Some people need some medication to reduce the struggle that they're going through, the mental health struggles that they're going through, or the substance use struggles that they're going through. So if you don't have access to a good psychiatrist and to good medications, chances are it's going to be harder for someone to recover, right, from such issues. And so I think, and that's something that, to be honest with you, as a European, I find it a little hard to. I'm still trying to navigate in this scenario in which basically here what I find is that here in America, if you don't have a great health insurance, you're pretty much not in good shape, right?
Yeah, it's tough to access really anything. Healthcare wise.
So I don't know. Like I think it's important for those. I think it's important for Congress to really take care of those low wage folks. Those low paying employees that don't have access to good health care and so forth, and cannot afford drugs and etc. Because at the end of the day, they are the ones that struggle the most. And we must help them. So that they can have access to great doctors and drugs and so forth.
I agree, Doctor. Well, there's a lot of work to do surrounding this whole topic and this industry as a whole, the hospitality industry, the servers and the like. We're looking forward to your continued research and how you put it out to us to find out more about what goes on in the hospitality industry in so many different ways. So there you have it, folks. A lot of work left to do. Take care of your servers out there for the places that are open. You guys are patronizing patrons at different establishments. Drop a little extra money in there for your server.
Yes, tip your tip those that work in the restaurant industry who deliver food to you because it's highly appreciated. They highly appreciate it. Yes.
Highly appreciate it. Well, I want to thank you, Dr. Diego Bufquin, for joining us. If you or a loved one needs help with addiction, call Amatus today at 855-80-SOBER or visit us online at amatusrecoverycenters.com. You can find more episodes of Share online at amatusrecoverycenters.com/share or subscribe to Share wherever you get your podcasts. Thank you, Doctor, and thank you for joining us on this episode of Share.
Thank
I'm
you.
Kabir Singh, and we'll see you next time.